So, today we'd like to discuss a little bit about getting pregnant. There are many questions that women have about getting pregnant. How long should it take? What should happen, etc. So, we'd like to go ahead and discuss that a bit. I'm Dr. Evelina Swartzman, and this is my lovely nurse, Amber Lehman. So, we'll go ahead and discuss a few things, and hopefully this will help you get pregnant when you want to get pregnant. So, what kind of things do we usually hear? We'd like to go ahead and touch upon those.
One of the most common, how long does it normally take a trying couple to become pregnant?
Okay. Now, you have to remember that we do not have a very efficient reproductive system. So, with each unprotected cycle, there's only probably about a 20% chance of becoming pregnant. And this translates to couples getting pregnant at about a rate of 80% within the first year of trying. So what that means is 80% of couples will get pregnant within that first year of trying without any assistance from a doctor, without any added help, without any extra worries.
At what point should I begin worrying if I'm not getting pregnant?
We typically recommend waiting a full year. So as I said, 80% of couples will get pregnant within the first year, and about 90 to 95% of couples will get pregnant within 2 years of trying. So I think a lot of it depends on your age, a lot of it depends on your circumstance, on your medical history. So those are the things that you need to consider. For an older couple, I might consider waiting a little less than a year before getting more involved. And for a young couple, waiting even up to 2 years may not be such a terrible thing.
Are there some examples of some things that I can do to help increase my chances of getting pregnant?
Well, the first thing you should do is a very good question. You want to pay attention to your cycles, obviously. We typically ovulate about 14 days before our next period starts. So that is something that we analyze through the months, and it becomes a retrospective assessment of when you ovulate. So if you know, for instance, that your cycle is 28 days long, then you ovulate on day 14, and so day 1 is the first day of bleeding. If your cycle is 30 days long, then you probably ovulate closer to day 16. That 14-day luteal phase can vary a little bit, but that is the more constant part of our cycles. So having intercourse right around the time of ovulation obviously will be the best way to try to conceive. And it's important to have your partner wait about 4 days before your fertile zone to give him time to build up his counts, his sperm counts.
Great. Are there any certain positions or any type of things like that that I can do to help increase our chances of becoming pregnant?
No, you know, those little suckers swim pretty fast. So the positions is not as important. You know, we do recommend you stay in bed for a little bit. Again, that's probably not as big of a deal. You don't need to stand on your head. But you should go ahead and stay in bed a little bit, maybe tilt your pelvis. Just wait, you know, for these, as I said, these guys are pretty good swimmers. Wait for them to swim to where they need to be, and then you're fine.
Now, when I come to time when I should typically be ovulating, should I be having sex every day? Or what days during my cycle, and how often should I have intercourse?
It's an excellent question. Well, first of all, there's a little bit of a debate about whether you should have sex every day or every other day. You know, I think every day might be a bit tiresome. So if it's okay to go ahead and start every other day, but it's really important to start right around ovulation. You might want to start a couple of days before you think you might ovulate, just in case, or if you could start right at ovulation, but continue to go on for another few days. So I would typically recommend, let's say you're ovulating on day 14, start maybe day 12, 13, 14, and then continue for 10 days afterwards, every other day for 10 days, because the egg is going to live for about 3 days, and so you might catch that egg a little bit after ovulation as well. So that's important to continue.
Okay.
Don't just think you're going to have sex once and that's going to do it. Okay, so just keep on going.
Are there any specific foods like caffeine, alcohol, tobacco, things like that? Will they affect my chances of becoming pregnant?
The short answer is probably no in small quantities. In large doses, if you're a chronic heavy caffeine drinker, it's probably a good idea to cut down. You don't need to stop drinking caffeine altogether. Alcohol, actually, you know, a little bit of alcohol will relax your uterus, relax your tubes, and, you know, relax you as well. So it's not going to hurt, but again, drinking too much alcohol can be a problem in the long term. So I definitely would recommend cutting back on that as well. In terms of other foods that may hinder getting pregnant, there's really nothing that will hinder you getting pregnant. But it's important to be healthy. You know, the most important thing when you're trying to get pregnant is to be healthy. And we talk about prenatal vitamins. Those are very important because of the folic acid content, and we're finding a lot of interesting things about the DHA, the fish oils, the omega acids. And smoking is definitely a bad thing to do when you're, and it can hinder you getting pregnant. It does constrict your blood vessels, can reduce blood flow to essential organs. There's a lot of problems with smoking and pretty much everything. So of course my recommendation is always to quit smoking, not to cut down, but to quit and be done.
Okay. How about if I have a regular exercise routine? Can I continue that while I'm trying to conceive?
Absolutely, absolutely. Not only while you're trying to conceive, but also when you're pregnant. Whatever your body's used to doing, you should continue to do. The exercise is an incredibly healthy approach to life in general, but and of course to getting pregnant as well.
Excellent. What might be some reasons that I'm not getting pregnant?
Mm-hmm. Well, that's a very important thing to consider. Well, obviously, the first thing we need to remember, and as women, we don't remember this, 40% of infertility is male factor infertility. So it's possible that your partner is not making enough sperm, or doesn't have quality sperm, or whatnot. So one of the first things that we typically as gynecologists do is we have your husband or your partner check his semen analysis. The rest of those issues could be, there's a multitude of issues. You could have scarring in your cervix or your tubes. That's something that we check later on. The first thing we typically check is ovulation. Make sure you really are ovulating, and make sure you really are timing intercourse appropriately with ovulation. We need to rule out any possibility of infection, which can obscure the cervical mucus and cause problems that way. Also, history of infection can cause some scarring that may potentially interfere with pregnancy as well, and that's something we can check for. We sometimes check other hormones that may reduce your ovulation cycles, and so those are the kind of things we look for if you are having a hard time getting pregnant.
Okay, great. I hear that as you become more older, it can be more difficult to conceive. Mm-hmm. Why is that?
A lot of it has to do with some of the things that I just mentioned. With you can get more scarring as time goes on in the uterus. If you have endometriosis, that's something I didn't mention last time because it's a scary word for a lot of women. That's another possibility for scarring, and again, it goes on and becomes more so as we get older. With every ovulatory cycle, with every bleeding cycle, you can get more scar tissue. The other really important thing to consider is the quality of our eggs. And as we get older, our eggs age, and with an egg that's not as high of a quality, for a better way of describing it, there's a lesser chance of fertilization occurring and continuing with a pregnancy, and also a higher risk of miscarriage because of that. So that's why, one of the major reasons for infertility is delayed childbearing. So women who wait too long to try to get pregnant, there's a higher incidence of infertility. So that's also something to consider. Don't wait. If you think you want to go ahead and have a baby, don't wait until you're much older. And that's a variable statement, For some people, 30 is old, but that's really not the case, So you need to remember that that's not an absolute number. But I definitely would recommend before 40, and if you can, with your first pregnancy.
Okay. Typically for a younger couple, what is some of the main reasons for the difficulty in a younger couple with conception?
In a younger couple, it's probably very similar to the older couple, except for the quality of the eggs. But I have seen, unfortunately, young women who have eggs that for some reason are, not what they should be at their age, but very similar in reasons would be anovulation and or scarring inside the uterus or tubes.
Okay. At what point should I be concerned that something's wrong medically with myself, mm-hmm. if I'm not getting pregnant, and what are some things I can do to further look into that?
The first thing you need to look at is your cycles. Are you having regular periods? That's a very clear indicator if your system is working well. You can also look for ovulation, and there are very easy ways of doing that. The ovulation predictor kits are sold over the counter, but you could just use a basal body temperature chart. It's a much cheaper way of doing that. You can print out a chart online. We have them available. It's very straightforward. And you don't need a special thermometer, just a regular thermometer. As long as you use the same one every day, then you get a consistent number. Excuse me, if you have any other medical conditions, that's something you absolutely need to discuss with your doctor. And also look at your family history. Is there a family history of specific congenital diseases or medical conditions that should be discussed that could potentially hinder you in getting pregnant?
Okay. For a couple that's interested in taking the next step, they've been trying pretty regularly to get pregnant. What would be some next steps to look into in regards to infertility medications or procedures? What would be some things you would recommend or could be the next step?
I definitely recommend talking to your doctor, because I think once we listen to you and discern what your potential problems might be, then the approach we take may vary quite a bit from one patient to another. But I think making an appointment, discussing all the potential medical problems, discussing your cycles, all of those things are important. Getting your husband's semen analysis checked, your partner's semen analysis, all those are very important steps.
Can you tell me a little bit about in vitro or other infertility tools such as medications that are used today?
Well, the first step is usually medication that will help you ovulate. Clomid is the one that everybody knows about. We can do that, and we can do that here at the office rather than going to reproductive endocrinology. But there needs to be a more clear-cut indication for it, because there are some potential negatives associated with taking Clomid. Some of the other conditions that I didn't mention when I kind of mentioned under the auspice of medical problems, like polycystic ovarian disease, insulin resistance, that can also interfere with ovulation, and that we can treat with some medication as well. The IVF procedures, before IVF, usually the next step would be intrauterine insemination, combined with a controlled cycle and possibly helping with ovulation, and then the next would be in vitro. Those are big guns, and those are usually done by the reproductive endocrinologists, and we probably rush into those procedures a little bit more in an older couple, and with a younger couple you have a little bit more time before you move on to the next step. As I said, 90 to 95% of couples will get pregnant within 2 years of trying without any help from us.
And do you know of any other alternative therapies such as acupuncture, acupressure? Are there things like that that you would recommend?
I think there's absolutely no downside to doing them. I think for a lot of people, those are very helpful techniques. And in fact, you can continue doing them as you pursue any kind of medical, conventional medical therapies, because it helps with relaxation, it helps with blood flow, and it helps with our psyche, and that's a big deal. You hear so many anecdotal stories about when couples finally stop trying to get pregnant, that's when they get pregnant. And there's probably some truth to that. Once they're finally relaxed and the stress goes away and your cortisol levels drop, the system works a little bit better.
Call on 101, Chris, 101.
So I'm a big proponent of those, and I think it's wonderful. Be careful of any herbs or medications that you take. That I'm a little bit more leery of. But in terms of acupuncture, massage, meditation, yoga, all of those are wonderful physical things to pursue.
Fantastic. And is there anything else that you can share with me to help my chances with becoming pregnant?
I think just be comfortable with the fact that things work. Our Mother Nature somewhat knows what she was doing when she designed us. Again, don't forget to take your prenatal vitamins. Be very, very healthy. What's good, my motto is, what's good for you is good for the baby. So stay away from things that are bad for you. And, pay attention to your periods. Don't stress too much about it, because, again, eventually you will get pregnant if you want to, and if not, we can help you out.